Welcome back to Boomer Health at Home. I'm your acting host today, Greg Jamian. Our host that normally does this show is out having a baby today. So, Brett Pulte, we wish you the best of luck, and he should be back soon. Today, we have a great guest, and her name is Julie Powrozek, and she is a registered nurse. Welcome, Julie.
Thank you.
How are you today?
I'm doing well.
Okay, great. So we usually start out the show telling our viewers, sharing with our viewers a little bit about our guests. So why don't you tell us a little bit about yourself and where did you grow up?
Okay, I grew up in Sterling Heights and went to Stevenson High School. And then from there I went to Macomb Community College. I did all my prerequisites for nursing and got accepted to the Oakland University nursing program.
It's a great program. I'm on the board of the nursing school there, and we they produce great nurses. And so now that's a BSN? Is that a 4-year degree?
Yes, it is.
I see. So tell us how long you've been a nurse.
So I've been a nurse. I graduated in December 2013. So I've been a nurse for 5 years. I spent my first 4 years in a critical care unit, cardiac ICU at Harper University.
You got right into it.
Right out of school, right into the hospital setting, into the cardiac setting. We dealt with all the patients from pre-heart cath and open heart surgery to post-heart cath and open heart surgery. And
so you had
it was a stressful time at times, but it was very rewarding.
You had to have your coffee in the morning.
Oh, yeah.
Put it that way. Well, that's great. And so you were in that position for how long?
About 4 years.
4 years. So, we always recommend to young nurses graduating from college to go right to the hospital and get that critical care experience.
It does. Build a lot of critical thinking, and so that way in the future you can move on into the home care setting where it's more of an independent setting where you don't have doctors and nurses right at the bedside being able to assist you.
Now you're in the home care setting now. Do you like it?
I love it.
Yeah.
I love it.
Well, let me ask you this. So you're a nurse. You've been doing it for a while. What's your favorite thing about nursing?
The reason why I went into nursing and my favorite part to this day is making a difference, taking somebody on their very worst day, family members and the patient, and being able to make a difference, being able to be a part of that memory, whether it, again, is the worst or happiest day of their life, you're there, being able to witness that.
Well, I'm sure when you walk into the room, you light it up. Okay, so that's great. Today we're going to be talking about pet therapy, the man's best friend, and I've heard some rumblings that you have a passion outside of work. Do you want to tell us a little bit about that?
Yeah, when I'm not at work, I absolutely love coming home to my 2 dogs, and my love for that.
What kind of dogs are they?
It's a Shepherd mix and an American Bulldog.
Ah, okay.
So my passion for rescuing animals and owning dogs started when I rescued my first dog, Roxy, who's home today, 9 years ago from a pretty bad situation, and being able to rehab her and see her build her own self-esteem and character was so rewarding.
So, Julie, you went from that to volunteering for a program. You want to tell us a little bit about that?
So I started realizing the need of how much help rescues need and everything like that. So I contacted a local small dog rescue out of Livonia, and I started working quite closely with them and fostering dogs throughout the years. I've adopted several dogs through them throughout the years, and just the difference that it makes in that one dog is very rewarding.
So what is the name of the organization you work for now?
Safari Animal Rescue.
And are they on the internet?
So it is, yep. You can go to safarianimalrescue.org, and my favorite part about this rescue is it's not just your typical kennel or shelter. Every dog that we rescue goes into the homes of our volunteers and fosters, where they're fostered one-on-one and rehab trained, prepped to go to another home.
Do you ever get involved in that process yourself? Do you ever?
I do.
Yeah.
So I've had several dogs throughout the years where I've fostered and trained. And
So you must see a lot when you go into these homes. I don't know if you do it yourself.
I do not know.
Okay, but I mean, these dogs probably go through a lot.
They do.
It's unbelievable how some people can treat their pets or their animals. On the news every night you hear some story about somebody mistreating a pet or an animal, and it's just heartbreaking. But you've probably seen some pretty bad situations with dogs coming out of some of these homes.
Yeah, they've come in pretty bad shape, and that's the best part, is being by their side and rehabilitating them to what the dog's outcome. You would never even know what kind of situation that they came from.
Now I have to ask this question, but how does the safari get its funding? They're a nonprofit?
Donations, yep.
People make donations because it could be expensive, right? If you rescue a dog and the dog has health issues, now
Absolutely.
you have to pay for vet bills.
Yep. And then all of our dogs, even if they don't require any medical treatment or emergency treatment, they still require vaccinations that are all up to date, spaying and neuters, before they go out to be adopted and go into their forever homes.
Mm-hmm. Well, that's great. Now, is there an intersection between nursing and pet therapy, let's call it, or owning a pet or caring for a pet? Do those two come together? Because it's kind of interesting to me. You're a nurse, and you've worked with dogs before, and then you do patient care. So you've been into a lot of homes, I'm sure, with pets, and
right.
You've probably have seen a lot of the positive impacts that pets can make.
Absolutely.
You want to talk about that intersection?
Anywhere from a mental and physical stimulus that they provide. I've heard going into home care and going into these houses, a lot of the patients are more happy to see their dogs or their cats than they are the rest of the family and everything. They're just happy to be reunited with them.
When they come home from a hospital stay.
So just seeing the smile that a dog brings, or the increase in activity, the motivation to complete that physical therapy or occupational therapy so they can go back walking their dog and playing with their dog and interacting with their dog, is very positive.
So it's a positive factor, right? And so, speaking of positive factors, let's talk about some of the, because I'm sure this, you didn't invent it, and we're not inventing that here. There's a lot of therapeutic benefits that are written and documented. But can we talk about a couple of those items? And we're talking about the impact that a pet, let's say a dog today, can make on a patient's well-being or health status?
They absolutely can. Anywhere from an emotional impact, where just boosting that self-esteem. A lot of empty nesters or anybody that's experience a loss, physically themselves or a loved one or something like that, and going through a hardship, that boosted self-esteem. There's nothing about that feeling when you walk in at the end of the day and your dog jumps up to meet you and greet you at the door. They're just happy to see you. There's physical benefits. Just that motivation to, I should walk every day and I should get my 10,000 steps, but that dog rearing to go, ready to walk with you and stand by your side, is definitely a motivator.
By the way, 10,000 steps is really difficult to get.
It's a lot of steps.
The only time I can get 10,000 steps is when I'm traveling and I'm in an airport and the plane lands at one gate, and the next plane
And you don't take the
connection
moving terminal, you actually walk it.
Okay, that's the only time I can get 10,000.
Right.
But usually I'm around.
There's also
5.
there's also social benefits. I mean, anywhere from being out in a public place, getting coffee, it's a conversation starter, to motivating that person to go out and go to Lowe's and walk around, and everybody stops to pet a dog.
So it's probably, like you say, if you're a single senior and you walk this dog, you're probably going to attract all kinds of other seniors.
Correct.
Because they want to visit with your pet. So things like depression. How would a pet impact a person's depression?
So just the support and companionship, again, putting a smile on their face, that feeling of being needed and loved, and there's just no comparison when it comes to.
Are you saying you can get rid of your psych meds and
No, but it could definitely aid in making the days a little bit easier, sitting at home and going through a hard time.
So let's talk about the physical benefits now of having a dog. I mean, you probably have to walk the dogs frequently, so that helps.
That's a good question. I mean, there are countless benefits that require a degree of nurturing and oversight, but they can have many benefits, such as, again, those dogs require exercise. They require walks. They require consistent training methods to keep that dog entertained, and so they don't get bored themselves sitting in a home. There's a financial risk, expenses just from the annual physical and vaccinations to, if anything happens to that dog. And we always have to plan for end of life, whether we're expecting it or not. We all have to come to terms with the fact that we aren't going to live forever. So developing a plan, talking to family and friends, adding it to your living trust or will, just to have a plan for the dog so he has somewhere safe to go.
We actually, as you know, been in the nursing business myself a long time, and I recall a situation where one of our nurses went to a home where one of our patients had just passed away. They were in their 90s, and so the nurse went in to deal with the situation, and as she's leaving, she hears his dog barking. And this woman had lived with this dog, and she could just shut the door, because the body was removed. So now there's this empty house, and this dog is sitting there.
Very confused dog.
Yeah,
very sad and confused dog.
So the nurse brought the dog back to our office.
Oh, excellent.
And then we kind of through a process. In fact, I took the dog home for a couple nights, and it didn't really work out. Dog had some behavioral issues, but brought the dog back, and then we were able to place the dog at somebody else's home, and that was very happy to have the dog. And so it was, good outcome and good ending to the story.
Good happy tale.
I like good endings. Okay. So there's social benefits, and I know we have a slide on the screen for our viewers to see, dealing with some of the social benefits. But do you want to talk about a couple of them? We've mentioned a couple of them already, but the increased conversations, the memory stimulus.
Right.
How does it stimulate memory?
So it develops a routine. I mean, some people get in a lull where they just don't know what to do, where to start on the to-do list. But having a dog develops a routine. You have to wake up in the morning. You have to prepare that dog breakfast or whatever, take him out for his morning walk or go potty. It forces you to get up and get moving. So it develops that schedule that creates a motivation to keep getting up every day and keep going and keep moving forward.
Yeah, I misspoke. I think the slide up on the screen is emotional benefits, and we're going to get into that now. You know, things like decreased loneliness, right?
Right. I mean, just having a friend, man's best friend. That's what they call them.
What would be a couple of the others? I mean, stress, sense of purpose. What do you think sense of purpose means?
Again, just having that routine, having that motivation to, you know, keep moving and give that sense of need and love.
Okay. Yeah, a reason to get up every morning to take care of the pet. And
absolutely.
You're not thinking about your own aches and pains and the arthritis in your knees. And you're thinking about the dog, and that makes sense. We touched on it briefly, but dog, you know, having a pet's not for everybody. I mean, you know, if you're frail, you know, a pet can be a challenge, correct?
Right, and it does take a lot of decision making, and one person, it's not a decision just for one person to make. It's definitely recommended they talk to family and friends and develop a support system to help them guide whether or not a pet is a good idea and how to go about it and which one to get.
Well, this show is called Boomer Health, so we're not all old and frail. Okay? But I just want to make a correction there. But some of the daily activities and let's say responsibilities. Okay, you have this dog now. What are you responsible for? Right? What are things that you can plan on having to do on a daily basis?
Every dog requires a certain level of activity and stimulus, just to keep them motivated and keep them focused on not getting into trouble at times. Regular exercise, depending on the breed and the size of the dog, it could require more exercise and things to do. It might there's dogs that have a certain job as far as like scent training and that kind of stuff. Just like you have your annual physicals, the dogs need annual physicals as well. So transportation, transportation to and from groomers and vet visits are a consideration.
Julie, you know, this term, we're hearing a lot lately because of the airlines and stuff, people traveling with pets. You know, service animal. What's going on with that? Some people say that, you know, they might bring a ferret on an airplane and say, I need the emotional support that my ferret. What emotional support can a ferret provide? I understand a dog and a cat.
So, and I mean, depending on allergies and where they live and everything, a dog might not be the most appropriate answer. So a therapy animal or service animal, I guess, is the broader term now. But it's any dog or animal that has been specifically trained to do a certain task.
So that's the key word, specifically trained.
Correct.
Is there organizations that...
There are many organizations that just specialize in training dogs to do certain things as far as scent training or, you know, leader guides for the blind.
Like in Rochester.
Correct.
So if I have a dog and I want to have it trained, it's probably best if it's a puppy, right, or to get it early. And I want to have it trained to get me the newspaper down at the front street every day. That's kind of obviously.
That's more of a fun task. I mean, that would be something that you could train a household pet to do. Service animals are more specifically trained, and they are picked out based on breed and everything, based on what that breed is good at doing, and trained from there.
We have a list here of some of the things that we can actually get service animals to do.
Right.
Do you want to go through that list? I mean, these are things that people, you know, these organizations have actually trained these very smart animals, pets, to do.
So the household dogs, they have gone through training and just been taught to open refrigerators, flip on light switches, pick up something that's dropped, just to kind of aid in that type of physical disability, if you will, and make the life of the human a little bit easier. There's dogs that have been trained to remind humans to take their meds or get medications as specifically to, for example, when they can sense a blood glucose level and when it's getting low.
Okay.
So when they sense that, they can tell that human to sit down, and they can go and get a treat or a snack or something for that human to eat and get their sugar up.
That's really simple. And now you read the paper and go online and everything is robots to do these jobs.
Right.
But I think I'd rather have a
friend.
dog do it than a robot.
Yep.
I'm a dog person, so not a robot person.
They're funner to cuddle with at night too than a robot.
Is there a large need for these? So we're talking about a couple different things. We're talking about service dogs or animals or pets, and rescue. Let's stay on the subject of the service pet, because as society ages and more baby boomers come about, it's kind of a burden on the labor force. I mean, you can't always have people out there doing everything. You can't hire people. First of all, it's expensive.
It's expensive, yeah.
So, having a dog in the house, it makes so much more sense to help out, assist. I could argue that, medication reduction could occur just from the impact of having
It's possible,
an animal in
it's
the
quite
home.
possible.
But, do the dogs receive a certificate, or is it just, I'm sure they must, do they go through doggy university when they?
So yeah, the specific dogs that are trained to do medical by prescription needs per se do go through a very rigorous doggy college that they complete and are solely for that purpose in the home.
Okay. So like if you're flying on an airplane, you probably need to have some kind of document that
absolutely
identifies your dog as a service pet.
Right.
You can't just take your poodle and say, Fifi is traveling with me today.
It's an emotional support dog.
I mean, there has to be some paperwork, obviously.
Correct.
Probably your doctor has to fill out some forms, and then you have to apply ahead of time.
Correct. There has to be a medical need, and the dog has to be medically certified.
So, where can a dog? Where can a person go to find the right dog that meets their needs?
Well, there's a variety of ways you can go about it, depending on whether
you have a saying.
Adopt, don't shop. It's my favorite saying.
Okay, adopt, don't shop. That's
but yeah,
good.
just do your research. Go online. Kind of, if you have a dog in mind, it's almost like clothes shopping. It looks good in the window, and then you try it on, and it doesn't look good for you. So what you've heard and everything, if you find a breed, do your research and try to find the most compatible. It's almost like a matchmaking game. Find the dog that's most compatible with you, and then go to your local shelters and rescues and talk to them about what you're looking, and they will help you spend a little bit more one-on-one time and match you up with the perfect mate.
Yeah, well, it's so as we get closer to the holidays, and there's always a holiday somewhere along the line. A lot of times children or friends will give a loved one or a friend of theirs a dog. It's like it's a drive-by for the person receiving it, because all of a sudden they have this dog in their life. Is that a good idea? Is that a happy gift to give somebody? It can be, but...
So, again, it's... A lot of people see that cute dog in the window, or see mom is lonely or whatever while they're in town, and they decide to go ahead and get them their dog. They don't think about the responsibilities and the day-to-day needs of that dog, and it can tend to be very overwhelming, and they're just not ready. So if you are planning on getting a dog for your loved one, make sure that there's planning and they're very involved in what animal you're going to get them.
Okay, because You could be creating more problems.
Oh, yeah.
You could be, depending on the
Right.
person's condition or health or even sometimes age. So let's say I want to get a dog. What are my options? I could adopt, right? And you say adopt, don't shop. Or I could go to the Oakland County
Animal shelter,
animal
whatever,
shelter, and they have a similar service there where they take in dogs as well?
Oh yeah, they're constantly in need of moving dogs out and finding the proper homes for these dogs,
Yeah.
because
And we
just
might
especially
say-
in the wintertime.
Yeah, dogs and cats as well.
Oh,
But-
absolutely.
Okay, or I could go to one of these stores that you see at the malls. I haven't seen one lately, but do they still have those?
You're seeing less and less of them. They're kind of getting a bad name, or trying to veer away from the puppy mills and the overbreeding and everything. So if you do want to start fresh with a puppy and everything like that, it's like having a newborn, but
Yeah, it's rewarding.
it is definitely rewarding seeing them from such a little age and grow up. It's just kind of like having a kid back in the house.
Yeah, I want to thank you for coming in and talking about this. And being a nurse, you've seen the impact that a pet can have, a positive impact. And, it was really great having you on the show today. And
Well, thank you. Thank you for having me.
We appreciate all this great advice and getting a view through the window,
Right.
as we say, into pet ownership and how it may intersect with nursing and patient care. So thank you very much for coming in, Julie.
Well, thank you for having me.